All right, welcome back. It is 9:33. We are here chatting about Wear Red Day. Of course, this is a big day for the American Heart Association, all about promoting heart health.
Yes, all about promoting heart health, and there's a lot that goes into this day, a lot of planning that goes into it. You've probably seen a lot of support. We even saw the Blue Bridge turned red this morning for it. So thank you so much for joining us this morning. Can you talk to us a little bit about why it is that we're wearing red?
Yeah, definitely. Thank you guys for having me. So we wear red on National Wear Red Day, which is today. It's always the first Friday of February, really just to bring awareness to cardiovascular disease in our community, but also nationally. So it's a great opportunity for us to get our whole community activated, out and about, really talking about why cardiovascular disease is so prominent. So it's actually the #1 killer of Americans. It claims more lives every year than all forms of cancer combined, actually. Wow. And so Wear Red Day is just an opportunity for us to turn the city red. Like you said, the bridge is blue, or the Blue Bridge is red today. But also we've got some other buildings turning red. I know Corewell Health is working on turning some buildings red for us. But we've got companies across the community, across the state, across the nation that are having their employees, their colleagues wearing red, sharing on social media. We've got people individually doing it, pets wearing red, all of the things, really just to start the conversation.
Yeah, and so Logan, you work for the American Heart Association West Michigan. You guys just had an event honoring women's heart health yesterday. Tell us about that and what that went to go support there.
Yeah, definitely. So every year we do our Go Red for Women event here in Grand Rapids. It's always a luncheon. That event yesterday brought about 300 individuals. We had about 30 companies involved, mostly women, but we had some men in the room as well.
Always got to support the women
yes,
in our lives,
exactly,
right? Yes,
exactly. But really what we were talking about yesterday was women's heart health. So not only is cardiovascular disease the #1 killer of Americans, it's also the #1 killer of women specifically. So 1 in 3 women will actually die from cardiovascular disease, again, claiming more lives than all forms of cancer combined. So yesterday was really about how we can support the women in our lives with being healthier, right? Yeah. So especially how that relates to women. We're so different when it comes to some of those signs and symptoms. Our heart attack symptoms look different. It's not always that crushing chest pain. Sometimes it's more, for women, it's more nausea or fatigue or headaches. So really starting to spread that education, but also, talking about things like menopause and how that impacts women's heart health as well. And then it's one of our biggest fundraisers of the year as well. So that fundraising will go towards research specific to women's heart health, but also things like getting women in STEM fields to help with that representation. And then a lot of our local impact rolls into that as well. So when we talk about some of our blood pressure work, our nutrition security work, CPR education, I mean, you name it, a lot of that comes back to that.
It really is important.
It is. It absolutely is. Can you speak a little bit more to the importance of not just this day, but this extends through the month as well, right?
Yeah, definitely. So February is American Heart Month. So across the country, again, we're really celebrating what that means for us and really centering ourselves and our communities on getting active, eating better, moving more, stopping smoking, doing all those things, but really focusing that education through the month of February, really kind of building that awareness. So yeah, we've got a lot of things happening throughout the month. Again, we're working really closely with a lot of our local companies to make some of those things happen. But I will say one of our biggest focuses for this Heart Month is around CPR education and awareness. So it's something that I'm extremely passionate about. My brother actually is a cardiac arrest survivor, and then recently lost my grandmother to a cardiac arrest. So the CPR aspect is so important. And it's things that we don't always realize, right? Like it could be my 19-year-old brother who has a cardiac arrest. It could be somebody who has a congenital heart defect, but it could also be somebody that you would never expect. And so having our communities be educated in how to step in with hands-only CPR really makes a difference. And it can make a difference, every day in your own life, but also, being able to step in for somebody that you've never met before as well.
Yeah, thank you for sharing that story, by the way. We really appreciate it. I know that this is clearly something that is very close to your heart as well. What are some ways that everyday Americans, the people living in our community here in West Michigan, what are some other ways that, we can take steps to be more heart healthy?
Definitely. So #1, and it's something that I know we all talk about and say that we need to do better, but is moving more. So the American Heart Association recommends that we get about 150 minutes of exercise per week. week. That could be moderate exercise, right? It doesn't have to be we're running marathons. It doesn't have to be we're lifting heavy
I
weights.
went on a 3-mile walk yesterday.
Yes,
So
that's perfect. Yes, walking is the number one thing that we try to suggest to people. But even things like cleaning your house, vacuuming, that can count towards your exercise goals for the week.
Okay.
So doing those simple things, getting up and standing, taking a 5-minute walk, during your work day, kind of working that into your normal schedule. So moving more and kind of helping our cardiovascular health that way. Nutrition is the other thing. So getting healthier fruits and vegetables in. We're never ones to say, cut out all of the bad stuff, but we're really talking about portion sizes. That's something we talked a lot about yesterday at the luncheon as well. But portion sizes and managing that, picking healthier alternatives. So if we're gonna go for chocolate, maybe we're going for dark chocolate. If we're gonna go for our proteins, maybe we're switching out our red meats for poultry or chicken. So doing some of those easier switches in our day-to-day lives, getting more of those fruits and vegetables included as well. So those are kind of two of those big pieces of lifestyle changes. But when we look to healthcare, we're really talking about knowing your numbers. So especially when it relates to blood pressure, it's one of the #1 preventable causes of not only cardiovascular disease, but also stroke. So really working with your healthcare providers to make sure that you know your blood pressure numbers and are getting those managed properly if you are having an elevated blood pressure, getting on medication, or making sure we're switching our diet, being active, things like that to help manage those blood pressure numbers.
Yeah. If somebody's sitting at home right now and they're thinking, this is great, I'm going to wear red today, how else can they get involved and be a part of Wear Red Day?
Yeah, definitely. So there's a lot of ways that we can do that. #1 is, I would say, share yourself wearing red on social media. That's a big one for us. Tag us. We're using the
There's a
hashtag.
hashtag, yeah.
Hashtag, yes.
Ooh,
Hashtag Grand Rapids Go Red is our hashtag for today, but also for the whole month of February. So as you're wearing red and doing things to be heart healthy, share that with us. We want to see that. And then, of course, donating to support the cause as well. So there's more information on heart.org. If you just type in Grand Rapids Go Red for Women, you'll see our movement come up as well. So donating to support our work is really vital as well. I would say those are kind of our top two ways to get involved throughout the month.
Yeah, Logan, I want to ask you, because you had mentioned that you have members of your family who are either survivors or have passed from a cardiac event. Can you talk about when you see people supporting the cause, like us here, I'm sure everybody in your office today is wearing red.
Very much.
Can you talk about how that makes you feel as somebody who this sort of situation is very close to you?
Yeah, definitely. I get so excited when I get an opportunity to talk about this. And so when I have people like you guys who are willing to help us spread the message, it really means so much to me. It means so much to my family. And I know that without CPR, my brother wouldn't be here. Without CPR, we wouldn't have had an opportunity to say goodbye to my grandma. There's a lot of things that have impacted me personally. And I know that together we can really make that change for other people in our community as well. And so I get really excited when we have an opportunity to talk about these things, when I get a chance to tell people to learn CPR, go watch our 90-second video, do things like that. It really just re-energizes me and sends me off into the rest of my week, like ready to take on the world and take on our mission and really make an impact.
Yeah.
Absolutely. Before we wrap things up here, can you give just a couple simple tips and reminders of signs of people who may be having heart health issues and then steps that they should take?
Yeah, definitely. So for heart attack specifically, we usually look for the #1 sign that we always talk about is chest pain and left arm pain. Like I said, there are some other symptoms specifically for women, but men can see other symptoms as well. So oftentimes that's nausea, vomiting, again, headache. Sometimes it's back pain or jaw pain. So really it's trusting your body. If you don't feel right or you feel like something is not okay, not normal for you, really should seek medical care at that point. Always recommend calling 911 when we're noticing those symptoms as well to get care as fast as possible. And then kind of recognize the stroke side of things as well. So again, we have our FAST acronym, so making sure you're paying attention to the face. So if there's any one-sided facial drooping, our arms are a good sign as well. So if you're lifting your arms and one isn't quite as even with the other,
didn't know that.
that's a great sign that somebody might be having a stroke.
Okay.
S is for speech. So if somebody is slurring their speech, garbled, can't quite understand them, that's also a good sign. And then the T in FAST stands for time. So we know that with a stroke, time is of the essence. the faster that you can seek medical care and get intervention, the more likely you are to come out of that not only alive, but also, you know, with minimal lasting impacts from that stroke as well.
Well,
Sure.
Logan, we truly appreciate you being here on the show this morning. And thank you again for sharing your story of your family. Of course, I know that's very important to you. Logan with the American Heart Association of West Michigan joining us here on our couch. It's 9:43. We'll be back in a few minutes.